Hi friends. So let's go to some questions here, straight away to the questions. So we have a client here, he is 48 years old with a moderate hypothermia. His temperature is um, 33 degree centigrade, and he's in the unit, and a nurse set a warming device for this patient. How you to set this warming device, that is the question. So which of the following actions should the nurse to perform? Okay, you already initiated therapy. So the active rewarming to increase the core temperature no more than 0.9 degree Fahrenheit or 0.5 degree centigrade per hour. And next option is active rewarming, increase core temperature as quickly as possible. Third option is active rewarming to increase the core temperature to 36 degrees centigrade, and the active rewarming to 38 degrees centigrade. So here there are options, three options are wrong and one is correct. The correct way of doing it, you are increasing temperature by 0.9 degrees Fahrenheit or 0.5 degrees centigrade hour. Okay, not as quickly as possible, not. And there is a cutoff when the warming is, the patient's temperature become 35, you are stopping the warming process. So then you are discontinuing. So the as not as quickly as, it's a slow process. So the second option was as quickly, that is wrong, and the other one was 36, third was 36 degrees centigrade, that is also wrong, because you are stopping the warming process when the patient reaches 35, and the 38 is a big no. Okay, so the first option is correct. Now here, nurse is in a surgical unit, and the patient is there with a simple surgical wound, and you have that wound is clean, and there is no sign of infection and well approximated. So here Jackson Pratt drain is in place and adjacent to the incision site. Okay, which of the following the nurse has to do here? So few things: surgical wound, well approximated, no sign of infection. So now what you have to do? So first option is cleanse the incision and drain site while wearing standard clean gloves. Okay, it's the surgical wound, clean gloves is no, you need a aseptic technique. Okay, for here, cleanse in a back and forth motion across the incision line and in a circular motion around the drain site. Okay, that's a wrong step of doing it. Okay, both incision site and drain site will be clean, but the stroke is different. Then the third is cleanse the incision site and the drain site together. No, it has to be done separately. And the fourth option is cleanse the incision and the drain site using a sterile saline solution. That's the correct option. Okay, so using a aseptic technique with the sterile saline, that's the correct option. So I will read it how it is given in this book as 2 rational. The nurse should use a sterile gloves as for the first option, it is wrong. Second, nurse will use a small circular motion along the wound edge. So when you clean the wound, it's a circular motion you are doing it, not back and forth as it was mentioned in the option, but cleanse from one end of the incision to the other. So you are starting from one end to the other, like in a circular motion. Okay, this prevent contamination and trauma to the wound. Okay, so you are not contaminating and you are not making it worse, more not giving more trauma. Already there is a wound and it's not increasing. Okay, that's what, by doing this in a circular motion you are doing it. Then the drain, the third option was wrong. The drain should be cleaned last, it has to be done at the last. Okay, separately from the primary incision to prevent the risk of again cross contamination. So if you do it together, so you are going to contaminate the clean wound. Okay, so you have to do at the last. Then the fourth option was correct. As I said, you have to use a sterile technique to cleanse the dressing wound, including using a sterile gloves, cotton tipped applicators, sterile saline, and sterile dressing. So let's go to the third question. Nurse emptying an evacuator of a Jackson Pratt drain. The nurse has drained the fluid into a calibrated container and has placed the container on a level flat surface. The nurse measures 20 ml of bloody fluid. Arrange the following actions. So all option is because you have to arrange how this actions takes place. So all options are required here. So you have to arrange them the way it has to be done. So let's see. First is dispose of the bloody drainage. Second option was can compress the evacuator completely. Third is replace the plug in a evacuator. Fourth is cleanse the plug with the alcohol wipe. Fourth is document the amount. Fifth is document the amount, order, and consistency of the drainage. So let's see how you are going to do this procedure by one, means by step 1, 2, 3, 4, 5. Okay, so let's see how it is given here. So the steps are, so the first step is the nurse will do is cleanse the plug with the alcohol wipe. First you are cleaning the plug with the alcohol wipe. This reduce the risk of contamination. So that is the purpose of doing that way. Okay, the second option, second act here is that thing the nurse would do is compress the evacuator. Then you are compressing the evacuator. Third thing is replace the plug while the evacuator is compressed. This create a negative pressure as the evacuator expands. So first is you are cleaning, then second is you are compressing the evacuator. Third is you are plugging it, the replacing. Third one is you are replace the plug while still that one is compressed in position, so the replace them. Then the fourth one is the dispose of the bloody tent. So then you take it out and dispose it typically into a toilet. Okay, this would be done after closing the Jackson Pratt drain to potentially infective agents and after resuming negative pressure. So you replace, then resume the negative pressure, then you go and dispose of the drainage, whatever the fluid you got, and you drainage. So you are taking a measurement of how much it is. The last thing what you are going to do is you are going to document. So that was the step. So that was the 5 step. So first was cleanse the plug with alcohol wipe. Second was the compress the evacuator completely, then the replace the plug. Third was the replace the plug in the evacuator. The fourth one was the dispose of the bloody drainage, and fifth is documentation. The last one is documentation. So let's go to next question, that is question number 4. The nurse is in an outpatient clinic, has received an order from physician to remove the client's suture. The nurse should do which of the following? Okay, the suture removal in outpatient clinic, you are doing it. So, okay, so first option is use gloves when removing sutures. Second is applying hydrogen peroxide gauze pads to cleanse the area first, then remove the sutures. Third is use sterile technique when removing sutures. Fourth is nothing. Sutures removal is outside of the nurse scope of practice. So let's see what's right and what is wrong. The correct option here is the sterile field is maintained, at sterile suture removal tray is used, and sterile gloves are used. That was option number 3. That's the correct option. Why option 1, 2 and 4 is wrong? Let's make to prevent incision contamination, the nurse should do it under sterile procedure. Wearing regular gloves is not sufficient. And question the second option was wrong. The prevent incision contamination should be sterile procedure. This answer choice not provided enough information to determine the proper sterile procedure are being followed. Okay, so that's it. Apply hydrogen peroxide. So its information is not complete. That's why that is wrong. And the fourth one was wrong. In many facilities, nurse do remove sutures and staples following a physician's order. So it after all, there are some institutional policy that like it's out not nurse scope of practice, but in many institutions with the physician's order we can remove it. So it goes with that. But when you ask when you answer the Nckex questions, so because it is the nurse can remove it. Okay, so when you work in certain institutions, you have to follow what the institution says to you. Okay. Question number 5. The medical floor nurse received a report from the emergency. There is a patient who is a 42 years old client admitted to the hospital for a hyperphosphatemia related to an ESRD, end stage of renal disease. The client receives continuous ambulatory peritoneal dialysis, CAPD, and physician has ordered a continuation of treatment during hospitalization. The nurse should do which of the following? So you are going to receive a patient from emergency department and this patient needs a continuous peritoneal dialysis. So what the nurse has to do here? There are some options given here. So let's see. First option is maintain a permanent peritoneal catheter with flushes of 0.9 percentage normal saline every 4 to 6 hours. The second option is obtain a pump in a preparation for dialysis infusion. Third is ensure the dialysate is refrigerated until ready to infuse and obtain a warming pad or a warming machine to warm the dialysis dialysate to body temperature prior to exchange. And fourth is weigh the client at the same time every day and use sterile technique while working with a permanent peritoneal catheter. So let's go to the options and why they are wrong and which one is right here. The correct option is, so the nurse would weigh the client at the same time daily. The nurse would use a sterile technique and equipment when working with the peritoneal catheter to infuse and drain the daily dialysate, including having the client and the nurse wear a surgical mask while the peritoneal catheter and hub are exposed. Okay, when the catheter is exposed, you have to wear mask and use sterile gloves. And why question option number 1 is wrong? The nurse would not flush. So it was mentioned that 0.9 percentage normal saline used for a flush for to every 4 to 6 hours. No flushing. Okay, and now dialysate bag is that is run, pump is not required, it's run under gravity. Okay, just the fluid is what is that, hooked on the shoulder level. The dialysate bag is raised to the shoulder level and is infused by gravity into the peritoneal cavity. And the dialysate is never refrigerated, but if you have a warmer, you can warm to the body temperature. That's it. That's that you can do, but never refrigerate. Okay. Dialysate for CPD not refrigerated, but should be warmed to body temperature prior to infusion if a warmer is available. Never use a microwave or warm the dialysate. This method creates a unpredictable temperature. So question number 5, no, first number 6, next one. An 8-year-old girl is discharged from the hospital with a new tracheostomy. The parent has received initial teaching in hospital and the home health nurse will reinforce this teaching. So per report, the parents are willing to learn and are grasping the concepts well. The home health nurse will expect the parents to verbalize and demonstrate which of the following is a teaching to the parents. Okay, so what you demonstrate, which of the following, what you expect. Okay, so the first option is the cleansing and dressing of the stoma will be done at least every 24 hours. The second option is it is not always necessary to suction before tracheostomy care. Third option is the inner cannula should be changed by the physician or home health nurse. Fourth option is hydrogen peroxide is used to cleanse the stoma. Let's see why which one is correct and which is wrong. So the correct option is option number 4. Hydrogen peroxide soaked gauze pads or cotton tipped applicators are used to cleanse the stoma area, followed by the use of a sterile water soaked gauze pads and cotton tipped applicators to remove the hydrogen peroxide. Okay, so you are cleaning it, then after that you are removing all the hydrogen peroxide which is remaining there. The stoma area would then be dried using sterile gauze pads to reduce the risk of infection and irritation. So you are cleaning it and keeping it dry. If any hydrogen peroxide remains there in the site, it may give irritations. Okay, and if that is that also there is a chance for infection also. So you are using hydrogen peroxide for cleaning. So this is what you expect the parents to verbalize and demonstrate for the tracheostomy. care. So why first was wrong? The stoma should be cleansed at least every 8 hours and ties every 24 hours. So 8 hourly, 3 times in a day you are doing it 8 hourly, and you can the ties every 24 hours. The one you're tying around the tracheostomy tube, it's in 24 hours you can change. Cleaning and dressing changes may be done more frequently to keep the dressing and ties dry to prevent infection. Okay, and that's why. Then the option number 2, suction the trachea and pharynx thoroughly before tracheostomy care keeps the area clean longer. So suctioning the trachea and pharynx thoroughly before tracheostomy care. So first you are going the deep section, then after that the tracheostomy care you are doing. Okay, so then the all the secretions and everything is taken out, so it will remain clean and dry. Okay, and the airway will be patent. Then the fourth option is the inner cannula can be cleaned and changed by the parents and should be removed and cleaned at least every 8 hours. As they when they do the care every 8 hours they can remove and clean it, and the parents can do it. It's not means not necessary the health care professional has to do it. Okay, so that is about our 6 questions for today. So I'll come with another set of questions as early as possible. Okay, thank you for watching. Bye.